going to kill me for starting a philosophical debate, Harvey, but I always wonder, this preventive care thing and this wellness thing that we're doing, it sparks a question to me that says, at what point are you bullying me into taking care of myself? And at what point do you have the right to do that? In other words, if I'm a smoker, which I'm not, but if I were a smoker and I chose to be a smoker and I chose to be that guy, is it fair that I'm treated differently than somebody who doesn't smoke because I choose to be unhealthy? And I don't smoke.
Yes.
Yeah, I mean, I know it's a discussion, but I'm curious to know, I mean, I have you guys at the table, I might as well ask you the questions that I don't usually get a chance to ask.
In other areas of life, it clearly is fair. If you don't drive safely, you pay a higher auto insurance premium because you create greater risk for that. And it's a similar principle. That when risk goes up, you pay a higher premium. Unfortunately, we don't in the United States really have health insurance. We have health benefit coverage. Health insurance, or insurance by definition, is something that is for low frequency, high cost, unwanted events. Your house burning down, serious auto accidents, those like that. And much of health benefits are high frequency, low cost. Well, having babies typically it's a fairly high frequency. It's a relatively low cost event, and most of the time it's wanted. So everything's opposite of what, by definition, insurance is. And so we're asking an insurance model to do something which is inconsistent with insurance. And so, but if you take the specific insurance piece, which is risks that are controllable, and when you behave in a way that raises risks, I don't think it's unfair to say, if you're a skydiver, you probably should pay a little more than someone who doesn't get higher than a chair. I mean, it's that kind of thing. And it's not an issue of morality or ethics. It's an issue of what risks are you assuming as the insurer.
Ron, do you have a question?
This is a fascinating question because I see us going down this road, and I don't know if it's good or bad, but we started with smoking, but are we going to go on weight next? Are we going to go on eating habits next? And I'm not sure if I'm for it or against it, but I see it starting now, and I think that's the crux of this whole thing is, where do you all see it going, and will it end anywhere? I'm not sure, because I think I could see more and more things being added to that list.
Sure, Randy.
The brave new world of health insurance is we're both, say, 45 years old. We pay the exact same price in what we're going to pay for premium. Now, if one person is more risk adverse than the other, is it fair for me to pay for, sorry, doctor, but you are a risk adverse person, but would it be fair for me to pay for somebody else who's risk adverse? Now, we used to have it where you paid a differential premium based on what your risk was or your health status. That would be one thing. But now that we're all paying the same thing, I think we should certainly should look at that, possibly varying it by that.
When you think about it, it's almost hard to believe that these concepts of lifestyle haven't hit health insurance before. Because when you think of the insurance industry in total, life insurance, long-term care, disability, auto insurance, your premium is predicated on who you are, what you do and don't do. And honestly, it's almost a little bewildering as to how it hasn't hit healthcare thus.
Interesting.
This far.
Think about, one of the fundamental, if you want to get to the fundamental, have a discussion around some of the fundamental problems in healthcare. I mean, one of them clearly is there's a disassociation between the price or the cost of care and people's actions because of this whole insurance model. And so if you think about what we're talking about around prevention, they're really not forcing you, I think to use the word I heard, they're really still incentives. You can choose, in this model about employers deciding, their incentives still, if you want to pay more and still smoke, that's going to be your prerogative. Quite honestly, your paying more won't come close to covering the cost if you get lung cancer. I mean, it still
Yeah.
won't.
Let me
Yeah.
parlay this a little
Yeah.
bit, because you're sparking some things that came up during some of my reading, and again, you guys jump in whenever you want.